Dr. Peter, welcome to the podcast.
Thank you for having me. This is the first time I've ever done this. I just want to have a good conversation. I love watching podcasts or listening to them. So
Yeah,
thanks for having me.
for sure.
Yeah.
Yeah, thanks for coming on. And this is also my first in-person podcast. Dr. Peter is a cervically based, or you work on the cervical spine. Is that where you target most of your chiropractic work?
Yeah, mainly as a chiropractor, yes, we focus on the spine, and specifically what I see most where I get most results with patients is by looking at their specifically their cervical spine, especially upper cervical containing the C1 and C2 bones, atlas and axis bones. And those are two of the most movable bones in your, by most or by far in your spine,
Mhm.
but also even in your body as well. And so when those bones move, you have to imagine through your spine is your spinal cord. And so through those top two bones in your spine is your brain stem, and your brain stem controls vital functions, right? Things you don't even think about: alertness, mood, heart rate, blood pressure, sensory function, motor function. I can go on and on, but things that you just kind of wake up and you take for granted. Yeah.
Right. And when it comes to brain injuries, is that a very typical area to get misaligned? As you said, it was one of the normal or the most mobile areas in our spine. Is that correct?
Yeah. So it is when I think of injuries, especially to the head, we think of whiplash injury. That is very big. I see a lot of patients in car accidents, sports injuries, just even simple slips and falls. Someone just standing up and hitting their head on a steel beam or something, right?
Right.
And so what happens a lot is I know I just talked about the top two bones, but C5 is a very it's a bone that is very prone to getting injured, especially during those injuries. And so that is like the kingpin because your cervical spine is going into your thoracic spine. Your spine has curvatures. And so your cervical spine should have a banana shaped curve, and it extends into your thoracic curve. Your C5 bone, if you could imagine, your cervical spine has seven bones. And C5, when you think of C5, it's not the middle of the cervical spine, but you got to imagine T1 and T2 are also part of that curve. C5 is in the middle of the curve, and that's what takes a lot of the that is like the first, it's the kingpin of your spine, of the cervical spine, and that is what can get injured vastly. Now, when we think of major injuries to the spinal cord, yeah, I do think of C1 and C2 especially. Reason being is you can have a misalignment in your spine as early as birth, coming out of mama,
Hmm.
right? So, and this is not well understood, or not okay. It's understood, but it's not well documented. So I want to focus more, I focus a lot on especially pregnant mamas that basically they go to the hospital and they're told what to do. I want to empower especially women to listen to your body, understand. I don't care if you have a home birth, if you go to the hospital, you can be at any part of the spectrum, but realize that you know your body better than anybody else. And so when you are delivering a baby, right, there's a lot of factors that go into a healthy natural birth, not just before, but during the birth. Are you having people that are trying to extract the baby outside of you, right? Are they trying to have you push when you shouldn't be pushing? Um, is there's are you listening to yourself? Are you thinking to yourself, this doesn't feel right? If it doesn't feel right, it's probably not right. So I see a lot, that's mainly my population. Um, but with other injuries and specifically brain injuries with what you focus on, right? Yeah, I definitely see upper cervical as well as C5. And if you can imagine, the brain extends into the spinal cord through your cervical spine. And so that is, it's like the water is coming from your head and it's going down a garden hose, which is your spinal cord. And that first part of the garden hose is in your neck. And so if we kink that garden hose right up here, the rest of the water going all the way down to your pelvic and sacrum area is going to be altered. It's the function is not going to be there. So that's why I take such pride in taking care of that area of the spine.
That's awesome. I think that when I've gone to people adjusting my cervical spine, I've gone to one other chiropractor, and the treatment, it's like that they're barely pressing on it. I'm not sure if your treatment protocol is similar, but when they go, you almost go are like, are they actually doing anything? Because like literally, like they'll be pressing but in a very precise way, like on my upper cervical spine, and they'll be pressing, and it does. They have the X-rays to show that it has been manipulating it in a positive way. Can you speak on that a little bit?
I would love to. Okay. So there are so many techniques within chiropractic and they all work. Not every, I don't do every single technique. I do the techniques that work best for me. And so there are techniques that you're describing that work very effectively. And what they lack in force production, they make up in absolute specificity, which
That's
is incredibly important, right? Now, um, there's a difference between an adjustment and a manipulation. And so a manipulation is moving bones just to move bones. It's not based on x-ray analysis. It's not based on what they feel. It's just it's just taking somebody and just doing things just to do it. The adjustment is scientific and it's specific. So it's scientific because it's basic anatomy. If you have if you have altered structure in the sense of a chiropractor, we look at the spine, bones. If you have an altered structure, your function is going to be altered as well. That takes place whether at the structural level in terms of your spine, as well as the smallest level is like a cell, right? If the cell is not structurally sound, we can call that a cancer cell. And so specificity matters. And so in terms of what I do, I will take x-rays. I will see exactly, and I take multiple views to get a good understanding of what is happening in different images so I can tell exactly, even though an X-ray is a moment in time, people have developed patterns that they're fully formed in right now. So even though it's a moment in time, especially the upper cervical spine, you've probably been in this kinked state or having a spinal misalignment for however old you are. Because like I said, birth traumas are the first signs that there's a spinal misalignment, especially in the upper spine. And so there's also other measurements in terms of specificity. With people with clinical experience feeling for what we call edema, which is basically inflammation around the spine. We use instrumentation such as Titronics or Insight, which shows heat differentials from side to side of the spine, and that's to get a better understanding of how much blood is actually being rushed around from side to side, meaning is there one side of the body that's working harder than the other side? That means there's an imbalance. That means there's something structurally off causing an altered function. So I hope that answered your question. I can talk a lot, so.
yeah, no, it definitely did. I appreciate that. I wanted to ask what are some typical or general pieces of advice you would give somebody based on your knowledge of chiropractic care? What are like five pieces of advice that you can give to just to anybody and the listeners listening right now, what they can do to improve their overall quality of life and their spinal alignment and their sense of well-being?
Good question. So, of course, as a chiropractor, I would have to say, of course, see a neurologically based chiropractor. I think I remember when I went to school, I had a professor whose one of his goals in life was to help create 8 million chiropractors and have them all take care of 1,000 people so we can take care of the world.
Wow.
That was his mission. And is that a feasible mission to get in, to succeed in the rest of his life? Well, he's probably pushing 70 right now, or maybe he is 70. And I don't know if that's feasible, but still it's still you want to have obtainable goals. I think everyone should be under chiropractic care just because, you know, if it's funny how now you go see a dentist, right? Or
Yeah.
you go see a dental hygienist, right? So,
That's a freaking great point, dude. Like
right.
you didn't even need to you didn't even need to finish that sentence because like I already knew what he was referring to, like the fact that oh, yeah, it's common knowledge, go see a general practitioner, go see a dentist, go see a specialized dermatologist. But for whatever reason, people are like, "Oh, the spine." Like, come on now, you're right.
Yeah, it's like I like to think about it like this. It takes a village to take care of a baby, right? A baby developing, it doesn't no, I don't mean to demean anybody. A mother and a father, like their roles are absolutely vital. I mean, and it doesn't have to be mother and father. Everyone grows up in different situations, but it takes a village to take care of somebody. What I mean by that is I was not only developed and my mind wasn't influenced just by my mom and my dad, but I had brothers, I had cousins, I had aunts and uncles, I had friends, I had teachers, I had all these people taking care of me. And yeah, it takes a lot to take care of a human being. I didn't become a chiropractor learning from just one person. I learned from many professors. I learned from doctors that were not doctors of chiropractic, but I learned from medical, doctors and from, I mean, everybody. So it takes a team.
It does.
Um, so I I believe chiropractors are a part of that team. And where I was going with where you were, I just saw the spark in your eye, right?
Yeah,
And so,
yeah.
yeah, so we take care of our dental hygiene, however often you do. I don't even know what the recommended is, but every 6 months, annually. But how often do you take care of your spinal health, right?
Hmm.
You may know people without teeth, right? You may know your grandma or grandpa that literally don't have teeth, or
Yeah.
some people have had injuries and literally lost their teeth. But
Yep.
how many people do you know with literally without a spine, right? There's this joke of, oh, spineless people, it's like,
Yeah, yeah.
well, yeah, they're spineless, but they technically still have this bony structure in their back,
Right,
right?
right.
But everyone has a spine, and there's a specific hygiene we need to take care of. Yes, it's bony. The bony part is to protect the spinal cord, and then the disc in between the bones, the discs are meant to move. That's why they're gelatinous. They're made of proteins and water,
Right.
and it's supposed to move. So when you don't move it properly, then it starts to degenerate. Discs don't just degenerate just because, oh, I'm getting old.
Right.
Well, is there less water in your system? Well, maybe, but that also because you're dehydrated. But also these discs can degenerate because you're simply not getting the motion in the spine that you should. So how do you get specific proper motion to the spine? Hi, I'm a chiropractor, and that's what I focus on.
I love that. And to go on with what he was saying, it's the same thing. That's why I focus on the brain. I had brain surgery about 7 or 8 years ago now, and it was really ruining the quality of my life. And what I realized is even prior to that, my brain health was really bad. And it's literally the most important muscle that we have. We go to the gym. This is like the analogy I like to use. We go to the gym to work out our biceps. We go out there and get some sun to look tan. But how are we forgetting to work the most important muscle in our body? Like literally, if I'm signaling to my pinky to move, that's the brain instructing me to do so. And so I'm not advocating that every single person needs to go see a chiropractor all the time or a brain specialist, but I do believe in preventative care because why not go ahead and deal with something that may be just at the onset of it before it gets really bad, before your spine is really bad. That's why you would want to go in and get spinal adjustments. That way it prevents you from being like this and slumped over. And the same thing goes for the brain. If you want your brain fitness and brain performance to be at its maximum, come talk to me because that's what I deal with. Because I learned through my own experiences what happens when the brain isn't working good to when it is working good. So um that's just my quick spiel. Yeah, like moving on to
I can touch
yeah.
on that though.
Yeah, touch on that.
Because the thing is that I'm not a chiropractor because I had a major injury to my spine and I needed to get an adjustment. No, I was 12 years old and I simply went to the chiropractor because my brother got us going. And so the reason I bring this up is because not everyone has to have a why um is caused by some traumatic thing that happened.
Right,
I don't have a traumatic why.
right.
I have a my why is I I grew up as the youngest person in my family. And so the huge benefit of that is that you learn from other people's mistakes. And so I was very aware of my brothers, my parents, cousins, everybody making mistakes and then redirecting the course of their life and how to manage with everything.
Yeah.
And I also learned from their successes, what worked for them too.
Mhm.
So the reason I bring that up is because I my why is that I want to get to people before things happen. I don't want a traumatic thing to happen, right? I don't want someone to just go to Dr. Brody here just because something traumatic happened. Now you have to go to him. No, go to him because you want to optimize the function of your brain. I mean, like you said, the brain is, you can't live without the brain. The brain does everything. It does things we have no idea
Yeah.
about. So, I'm yes, I'm preventative, but there's my story is I've always been preventative. I've never had a major injury. I've had a
Yeah.
broken bone here or there. I've never suffered from major symptoms.
Right.
I just am who I am because I've learned from people and I realize, oh, I don't want to grow up and experience that.
Right. And more power to you because of that. That's it's really awesome. Like you can learn from your own mistakes, but even more powerful, learn from the so-called mistakes of other, learn what's worked for them and what hasn't worked for them. And so you don't have to be like a wrecking bowling ball walking down the street, like just crashing into whatever. That's usually not the best way to go. But yeah, I love to touch more onto your story because it's really interesting. Um, just let us know like what did that look like growing up, and then once again you touched on how uh, you got into chiropractic as your profession, but what are some of the lessons that you learned from learning from others?
I guess the two most influential people outside of my parents are definitely my brothers, and they're very different people. So, my brothers are 7 and 9 years older, so they're considerably older. One of them is your regimented, never had to worry about him. He always did his job. He got driver's license the absolute first day he possibly could, right? Just he was just like my parents never had to worry about it. When he was applying to schools, he took care of everything. My parents were like, "Hey, do we have to help with the student loan Nope, I got it taken care of." And then my other brother was almost, I don't want to say the complete opposite, but based on everything I said is pretty much opposite.
Yeah, yeah,
Where it's like if there was a curfew, we he didn't follow it. I mean,
yeah,
did he lie a lot? Yeah, he probably lied a lot. Did he, take some money from my parents, purse or, wallet? Yeah, here and there, Um, he was kind of a rebel, but they were both good people, right? And so I learned that it's good to be orderly and structured and disciplined and know the next have a plan. But I also learned that from my other brother that made, that my middle brother that, wasn't necessarily straight laced, that it's okay to be the black sheep. You don't have to follow the crowd. You should you should use your own intuition on things. Now, I just said a lot of positive things about one and negative things about the other.
Yeah.
It's not, they're not, it's not that one's perfect, not one's an angel and one's a devil, but
Right.
that's not true at all. It
Yeah.
actually is very complicated.
Yeah.
But the middle brother, he was always the one, he was like my best friend growing up,
Yeah.
And so he taught me to always follow your heart, right? If you make big decisions, follow your heart. Small decisions, be smart about it. Like
Yeah.
actually take the rational route.
Yeah.
But yeah, don't follow the crowd. Follow what you actually feel is the right thing to do. And he's the one that got me into chiropractic, right? He's the one who, unfortunately, he wants to be a chiropractor. School is just not for him, right? And so he went the route. He actually owns a CrossFit gym now. Also, kind of a rebel CrossFit. I don't know. It's becoming more popular, but it's like, those
Yeah.
people that lift weights and
Yeah.
could get hurt. Well, he's very. It's funny because yes, people can get hurt, but if you have proper coaching, if you have proper training, if you have someone who's actually looking out for your best interests, like my brother does, then you won't get hurt. You actually will see your everything maximized. So I would say those are the two biggest lessons from my brothers:
Yeah.
discipline and following your intuition by far.
I love that. Like I'm learning new things right now because I completely identified as your brother, especially growing up, and I'm still a little bit spacey at times, and I'm a little non-structured in what I do, but little by little, I want to piece together more structure and have more of a balance there. Like, you don't need to be like an army corporal to have structure in your life, because without structure your life just falls apart. But with too much structure, it's like that you get so dominant and then you can't even enjoy the present moment or enjoy time because you're over disciplined. So like I think those are some great life learning lessons that I got just from this little conversation here. Yeah, back to the cervical spine and the brain and how that functions. What fascinates me is like the brainstem, as you said, it's right there. It's right close to C1 and C2. So, um, and it deals with like alertness, respiration, pressure, or I mean, breathing rate and stuff like that. What are some big what are some big wins that you've seen for the clients that you have worked with by helping them with that?
I'll give specific examples.
Yeah.
Um, I remember seeing a 13-year-old girl. I think it was about a year and a half ago, 2 years, something like that. And she was on a plethora of anti-anxiety, antipsychotic medications when she came in. And she wasn't the reason why. There was actually a mother, the daughter and son that all came in. It was really the mother why they came in. But then we said, how are your kids doing? Right. And so they brought the girl in. And I think after seeing her, I think it was 2 or 3 times a week, and I think it was about a month or two in, she was showing progress, but
Mhm.
after 3 months, she was off of all her medications.
That's fantastic.
So the thing is people don't have a medication deficiency; they have a neurological issue. That's why you come to see a chiropractor, you come to see Dr. Brody, because something neurologically is off, and we need to take care of that. So there's that girl that was very impactful for me, just seeing that. And one of my first patient, she 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 was transitioning. She was transitioned from a man to a woman, and she was on hormone therapy. And this is someone who, you know, it's a lot of mental health issues.
Yeah, there's a
Just,
lot of
I
that.
mean, you could tell, and she knew it too, right? And so, um, she was the best patient though.
Really?
And she was so good because she was so consistent. She was so supportive. And this is when I was in school. You know,
Yes.
we're seeing this is literally my first patient ever,
Yeah.
outside of the friends I was beating up in chiropractic school.
Yeah.
And so it's amazing. I changed her technique and how I approached on adjusting her. Before, she was getting adjusted basically from her whole spine, right? And then I had the intuition, right, of saying, let's just focus on the top two bones in your spine. And we were getting her adjusted for a few weeks, and she wasn't experiencing the anxiety and depression anymore. Her headaches had diminished. Was she still experiencing headaches here and there? Yes. It's not like everything just happened just like that in
Right.
2 weeks.
Yeah.
It's no, it doesn't. It's not a light switch. It's a dimmer switch. People have to realize that. Some people have those miracle cases, but that to have that to be my first patient and to see that, I was like, okay, I know who I got to take care of. And as much as I people with anything, I don't care what it is. My friend loves adjusting people's low backs and getting their low back pain away.
Mhm.
He just loves doing it.
Yeah.
I just love looking to the upper spine for these mental health issues and balance and coordination and headaches, migraines, dizziness. I love taking care of people with that, and I think it has to do with just that first patient that had such an impact on my trajectory. So those are two cases. There's gut dysfunction. Oh gosh, this is a good one. So uh this guy 20, I think he was 20 or 21 at the time, and he came up to me and he said, hey, do you help with, I see on your sign it says that you help with diarrhea, constipation, acid reflux. I was like, yeah,
Yeah.
what's going on? He's like, and he's trying to be quiet, right? There's people around. He's like, you know, I can't eat sometimes because after I eat, I immediately just have diarrhea. I mean, and it's I know it sounds funny to some people. Oh, like it's not funny because he has to structure how he eats around travel, around work, around spending time with people.
Yeah.
So he's not this gut dysfunction is actually causing an eating disorder
Yeah.
because he has to change when he eats based on who who he interacts with. And
Yeah.
so he said, "Do you help with this?" I was like, "Hey, what I tell every patient is I don't know if I can help you until we do the proper testing, to do the all the exams. I'm not someone who says I can cure you. I don't cure anything. The body cures, right?
Yeah. Yeah.
Right? You and I both agree on that for sure. And so I said, "Hey, come on in. Let's see what's going on." And then lo and behold, I look at his spine, and it was actually his upper spine, but also a part of his low spine that was that had misalignments. And I think it was actually his low spine that I think was actually causing more of the issues, causing the dysfunction. Reason being is because nerves from the low spine, they control your digestive organs. But I also look to the upper spine because the vagus nerve controls your digestive system as well, the parasympathetic part of it, which is your rest and digest. So we addressed both, and he he was not experiencing that diarrhea anymore. I think it took him a couple months. So that was really impactful too. I think those are I could go on, but
Yeah.
those three were probably the most impactful, and like looking at it and thinking, man, chiropractic is more than just neck and low back pain.
Yes. That's very powerful. I'm just double checking to make sure everything is good on this end. Yep, it is recording. So yeah, I do like a lot of different live edits. This isn't even gonna go on it, but like it's cool that I can do these like tiny manipulations to make it smoother. But yeah, um, yeah, um back to that's just really impactful, first of all, because like it shows how changes or why we do this. Is exactly why we do this. We want people to feel better. We want them to be more productive and overall just have better off quality of life. I'm just fascinated with what actually is occurring when you're doing a spinal adjustment. Is it activating our sympathetic system initially?
That's a good question. So based on the spine, there are areas that are more parasympathetically driven and areas that are more sympathetically driven. So your cervical and your pelvic sacral region are more parasympathetically driven, whereas the middle part of your spine, so about where your shoulder blades are to about, I mean, your low back, not including your pelvis and hips, that is where most of your sympathetics are more driven. And so, um, when I see someone that is extremely stressed, I mean, their bodies are just chronic fatigue and chronic pain and things like that. I say we are not going to adjust the middle part of your spine because that's more sympathetically driven. So there's some people that are experiencing much more drastic symptoms where I only adjust their upper spine or their low back. Now, those are those are the extreme cases, but most people I adjust I adjust full spine. Now, here's the thing. I adjust the full spine. I'm not just focused on the neck. I adjust whatever's in the spine, and I even adjust extremities as well. But I know where the bread and butter is right here in terms of what I look for. So that would be my answer for that.
Cool. Um, what are just some general alignment or general principles that you can tell people that they can do like right now to get a quick win?
A quick win.
Like a quick
So
win uh as far as like alignment or like exercises people can do or things that they can do just to benefit their spine like at home.
right. It's like spinal flossing, right? Yeah. What can you do on your own? So I would say specifically for your spine, I would say it always has to do with posture and movement. Like, let's look at the basics. Posture. And people think, what I don't even know what people think necessarily when it comes to posture. I don't know.
I don't know
Right?
very much about it. That's all I know, you know.
Yeah,
It's just
so
that I'm supposed to be straight up like a carrot or
it's this weird conundrum where you want to be it's this balance between order and disorder
right.
where like we want to make sure that we're in a proper alignment at all times and but you're not a robot. You also have to move.
As
You can't
as I
yeah.
adjust myself in the
Right.
moment.
Me too. Once I said posture, I was like, oh crap. Nah. Right. We're all guilty of it. I mean,
Yeah.
even me, right? So it's I always try to think we're a balancing mechanism. So from forward to backwards, is our head coming forward? A lot of this is societally what I see today
Hmm.
is one of the major problems when it comes to posture. It is the major problem because people's heads are coming forward and the whole rest of the spine adapts around it. So I actually just had a patient the other day come in and say, I have low back pain, but I know it's coming from my neck. And I said, wait, I didn't even have to tell you that. That's what I usually tell patients is because your head is forward 2 inches, whatever, what happens in your low back is that it has to hyperextend in order to compensate for for the weight distribution from back to forward. So people get low back pain because everything's compressed.
Right.
But really, if I adjust that and don't adjust the upper spine, that low back pain is just going to keep coming back and back and back.
Yeah.
And then the other balancing mechanism is from side to side,
Oh,
right?
that's one I
So
never even considered, to be honest. So yeah.
yeah. Side, so your spine should be nice and straight from looking at it back to front to back or back to front. And then it from the side view you should have three distinct curvatures. So I just kind of address the curvatures, meaning if you have a straightening of your cervical spine, then your low back compensates by overextending. But from the straight on view, from the side to side view, right? So if you a lot of misalignments that I find in the upper spine, I even just saw it on you just
Yeah.
earlier.
Yeah.
It's funny.
Yeah.
um, head tilt. What
Mhm.
happens if we have a misalignment in our upper spine? Could happen as early as birth, like I said.
Right.
And then what happens is that usually if your head tilts to one side, that the shoulder on that same side tends to ride up, and that's called the riding reflex.
Interesting.
So what that is it's your body's uh, adaptation response. And so the reason why it does is because if you were, let's say I'm gonna over exaggerate it, but let's say your head is tilted like this, you wouldn't walk around like this everywhere because just have you'd be nauseous just walking around like that all the time. So what
Right.
happens is that when your head is tilted, your body naturally wants to keep your head level with the horizon so you're not nauseous. So your head is not feeling like it's on a boat, right?
Right. Yeah.
So our that shoulder tends to ride up, keep our head nice and or our eyes nice and level. So I look at the spine from either a top down point of view, which I just kind of mentioned, like
Mhm.
this is like the electrical circuit, and if you put down the dimmer switch, then everything else below it dims down as well. But also from a structural, from a foundational point of view, from your foundation up, think of a house, right? If you have a poor foundation, everything built above it is going to be not structurally sound, and you're going to have to keep correcting those improper structures unless you correct the foundation. So the foundation of the spine is the pelvis. So if your pelvis is unleveled, all the bones above it are going to be altered. The reason why people have scoliosis, the scoliosis isn't the problem. It's actually probably your foundation
Hmm.
that's the problem. People don't
Interesting.
realize that.
No, I would have never considered that. And uh, not to put you on the spot, but I have some issues. I think it's on this bone. It's like C2. I don't know if
Are
that's
you saying
C2.
are you
Like
saying the one that's
this big ass bone right here. Well,
it's called the vertebral prominence? That's usually either C7 or T1.
okay, so
Usually.
yeah, so like that big bone, just I want to know from my own perspective or my own selfish reasons, like what um it's like very tense back there. So I'll go ahead and put you on the spot. You can ask me questions, I guess. If that makes sense.
So
Make it interactive.
yeah. So I look at the spine almost like a fuse box. Because there's nerves that come out of every single bone, out of every single area of the spine. So there's 24 levels of your spine. At each level, there's a pair of nerves that come out, and they control every organ of every cell tissue organ of your body. So when I'm looking at T1, I'm thinking more of maybe, do you have any metabolism issues? Like I think of maybe like thyroid, in terms of like organs.
Typically no issues with my thyroid
Okay, that's good.
that I'm aware of. Yeah.
Okay. So again, like just because you have a misalignment at the area of the spine doesn't mean you have these symptoms,
Yeah.
but it could be that they haven't come up yet.
Right.
So at T1, I'll be honest, that is a very tough area to adjust.
It's a big bone, you
It's
know.
a it's not even because it's a big bone, but it's because people have so much stress with their heads coming forward,
Yeah.
it makes this bone just much more and more difficult to move. So
Oh,
what I find is that once you get that cervical curve back, then this bone is much easier to move.
cool.
But yeah, I think of T1 more of a thyroid issue in terms of organs, right? I mean, I can go down the entire spine, right? Pancreas and adrenals, I think of T11, T12. We're talking about gut dysfunction. You can think any, well, if you think of like acid reflux, that's gallbladder. We're talking around maybe like T4, T5, T6. Even the heart comes from, T4, but the heart can also be innervated from C1, right? So uh, the way I don't diagnose people necessarily. I do
Yeah.
diagnose people, but I look at it through a different point of view where I'm looking at like the body as a as a what do you call it? The fuses, the circuit breaker, and you have each thing connected to through the spinal
Yeah.
cord,
Yeah.
right?
Yeah.
So that's how I look at it. Yeah.
Cool. Yeah. That's interesting. I just wanted to ask out of my curiosity and make it more interactive. I wanted you to leave with the last little bit of information on this podcast. How can people get in touch with you? How can they reach out to you? And all that good stuff.
Well, I am Dr. Peter Harris, and I'm opening my own practice in Colorado Springs called Hexis Chiropractic. So as of this very moment, the office is not ready, but I am still seeing patients. You can check us out on Instagram, on Facebook. My girlfriend helps me out tremendously with the marketing for us. So
Yeah.
that's just not my thing. I talk to people. If you haven't noticed, I can talk a dog off a meat wagon. I come from two parents that are very, very social. So I'm the person that just likes to talk to people. So but you can follow us, Hexis Chiropractic. It's spelled Hexis, chiropractic. I'm not going to spell that. And other ways you can reach us. I mean, those are the two best ways just to help support us. I try to give good information on spinal health and understanding of the human body.
Yeah.
And I even had Brody on a reel on our Instagram, and my goal is to provide information that is helpful to people. Just like Dr. Huberman is somebody who I hope you know who Dr. Huberman is, right?
Yeah.
He provides such valuable information on a weekly basis, sometimes bi-weekly, right? Or multiple times during the week. But he's someone who is just so selfless, and he's like, these are zero to low cost tools you can use. That's what I want to do.
Exactly.
Right? I'm not here to take people's money. Like that's not the point of what we do. Like,
No.
do I need to function? Yeah, of course, but I love just educating people. I mean, I think I was talking to you the other day saying doctor means to teach.
Yep.
And so that means we know our information so well that we can explain it to a 5-year-old.
Yes.
And I'm not saying people out there, I'm not saying you're 5 years old. I'm not saying that.
I am.
But like when it comes to, I don't know, buying a house or like the legal system, like I just don't know these things.
No.
I tell the person who knows it much better than me, explain to me like I'm a 5-year-old, because
Exactly.
that is the level that I'm at. And unfortunately, a lot of people I feel like in today's society, it's getting better and better because of a lot of people doing podcasting like Dr. Huberman
Yep.
and other people.
Right.
But still people just don't know what they don't know. So that's what I want to do is educate people the way I was taught, or the information that I've been given, and just give it back to people because it's free. Like it should be free. It's
Yep.
it's information.
It
Like
is,
it can be so impactful. Give just to give. The world is not a zero sum game. It's full of abundance. So keep giving. And the world is going to give back. It's always giving back. You just don't realize it.
Yeah, I couldn't say it any better myself. That I love that philosophy. The information, uh, in empowerment, education is empowerment. So it's your responsibility to educate yourself and empower yourself. So by learning this information, you can utilize that, and it's only as good as how well that you apply it. So you have to build a foundation of knowledge at first, and once you have that built, then you can build on up from there and empower yourself in the most important thing, which is in your health. Because without your health, you have literally nothing. And I don't, yeah, people know that when you have your health, it doesn't matter if you have $1 billion in the bank. if you can't walk down the road. So thank you so much for coming on. It was awesome. First in-person podcast, and this guy definitely knows some stuff. So follow him on Hexis at Chiropractic. I'm going to put the links down here. And yeah, I'll let you have the last words.
I thank you for having me. I wish I asked you questions. I feel like, I mean, I understand this is more of a this is more of an interview. I mean, I want to know more about this guy too, even though we did have a good conversation. But thank you for so much for putting this on. Like, I mean, I love just talking. So clearly, I think people figured that out, and I'm hoping that people, even if you like what I say, don't like what I have to say, health is your number one asset. Um,
100%.
a healthy person wants 1,000 things. A sick person just wants one thing. I've seen too many people in my family get sick, and some people die because of their health, right? Very too early. So take it seriously. It is don't put off these signals that your body is telling you. And the signals is not just pain, but it's also the other little symptoms, even just like trouble sleeping. That is a major symptom that your body is telling you, I just feel off and I need some help here.
100%. Thank you for coming on. Quick high five. Later, all.